What happened when she started the journey, things got metastasized very quickly. Clearly remember that there was a period of 6 months where she was free of cancer.
Ajay, I want to commend you because you could have just gone into a shell, but you decided to make the most of it. You took the experience that you had with Alka. Hello and welcome to the first episode of What Rubbish, a holistic approach to treating breast cancer. Now, we'll get into how we came to the title, What Rubbish. But first, let me introduce the founder of the Alka Ohri Foundation, who also happens to be my brother in law. We also call him Johnny, Ajay Ohri. Ajay, can you talk a little bit about how the foundation came about?
Well, thank you, Kumar. I'm very excited to be here and starting the podcast. And last year, when Alka passed away, my wife, and I think it was in February, February 20th, 2023. The experiences that we saw and faced during the course of her treatment made me realize that there are several gaps because the sufferings that she went through and the pain that she went through, and I realized after the fact that there were some missing gaps that we need to take care of. And I think when me and Alka we talked about towards the end of her journey, she was always asking me. I said, "There's got to be a better solution. There's got to be a better solution." And I think that's one of the reasons that made me start this foundation, so that we can bring awareness, we can bring some different knowledge and different way of treating holistically for the breast cancer patients.
That's wonderful. So let's talk about the title, What Rubbish. How did we come to that title?
Well, you
we
know,
all know as a family, we already know, but
Yeah.
maybe we should, yeah.
Well, Alka is a no-nonsense person. Those of you who knew her, and everything that she disagreed with, or she didn't understand, or she didn't like, it was basically two words that come out of her mouth was "what rubbish."
What rubbish?
And cancer happened to be also a kind of a what rubbish for her. Not kind of, but it was a what rubbish for her. She did not believe that she got it, and but that's how we realized we thought about this idea collectively
yeah.
that what rubbish would be a good way to get people's attention too.
Yeah, and what rubbish is also probably it also signifies a deeper meaning because what we saw, at least from my novice point of view, you are of course in the pharma industry, but is that even doctors are at a loss of words beyond a certain point, at a certain point in the treatment, they even don't know what to do, and that's why you're getting a lot of traction in the pharma industry with your approach.
Yeah.
So it's almost as if they're all collectively getting together in this in the medical field and saying, what rubbish, there has to be a better way to do things.
Absolutely, and I believe that our that's why I believe that the holistic means is a missed area, even though there's a lot of attention that is happening today for holistic way of doing things, and I think it's a matter of because insurance companies don't reimburse it, that is one of the challenges. And I think that's one of the reasons that these cancer institutions who even have these nutritions or yoga or meditation, it's not heavily resourced to support that activity. And I think some of these things we have to bring that to the surface.
Yeah, so Ajay, maybe you can briefly go over the journey. I know it's hard for you to talk about it, hard for all of us, hard on the entire family.
Yeah.
But there was a period where the holistic kind of approach, maybe not formal, but came into her life, right?
Yeah, it did. And what happened when she started the journey of treatment, things got metastasized very quickly. And but being the fact that she started reading Gita, she started doing meditation, she started exercising, and I realized I clearly remember that there was a period of 6 months where she was free of cancer. The doctor did not give her the complete green light yet because it has to be 1 year, and
Yeah.
then they do the retest and all that stuff. But after 6 months, after September 2021, I remember when she went through scan again, they found another spot. But before that, during that period of time, she was absolutely clean. And we don't know the reason as to what happened, but one of the reason I think about, because she basically stopped doing what she was doing. So that made me realize after the fact that there is something goodness to this holistic treatment. It may not be the only way of treating it, but it is the one best way to combine.
So let me ask you this, Ajay. There is a lot more awareness today about being centered, being mindful, meditation, yoga practices, and there is more teachers and gurus than you can like they say, shake a stick at. There's so many of them.
Right.
Um, and there is more, I believe there's more awareness, So what is the gap here? What is preventing, somebody that is unfortunately diagnosed with breast cancer, any kind of cancer, what is preventing them from continuing or starting a regimen like that?
That's a very good question, Kumar, because one has to be very careful as to who you seek knowledge from and who do you get information from, because there are too many information available on Google. So how do you really make a decision whether this is the right information for me? And I think, of course, I'm not a doctor. I think you got to go to your oncologist and talk to them and have a discussion. But I think one other important factor is that within these cancer institutions, there is integrative oncology group. And I think they believe in the holistic side of the treatment. I think we ought to talk to them. We don't get the access to these people. And I think I realized after talking to so many exercise oncologists, integrative oncologists, oncologists in nutrition, these are the specialists who know from the holistic approaches as to what they can combine things with. I would not sit here and say that holistic means is the only means, but it's one good mean, because you are what you eat.
Yeah, yeah.
And it's very important as to what you eat. Number two, your body is designed with so many billions of cells, as you can remember. So any cell can burst anytime. But I think it's important to understand that yoga, meditation, proper nutrition, eliminating sugar, exercise, walking, has some means to it.
Let me ask you a question. There's already groups that you call it integrative approach.
Integrative oncology.
Oncology, right? So aren't they not effective? Aren't they not doing these things already? Teaching them, So what? Maybe you can use Alka's specific example. What was the gaps? If there's already an integrative oncology team, what was the gap in nutrition? Or I know that medical issues getting the treatment, but what was the gap in nutrition or mindfulness or staying calm, or, all that.
Yeah.
What is the gap? What
gap,
are we trying to fill here? There's already an integrative oncology.
So the gap was that the resources were not available or not there because the insurance company would not reimburse it, reimburse that service. And so the encouragement was there that why don't you eat this? You should not eat this. But there was no follow through. So these patients are emotionally so exhausted. They are thinking about, they are not in a very happy zone because they are thinking about whether they will live tomorrow or not. And I think there has to be a mentorship. There has to be some kind of a support system where they can call and say, did you do this yoga? Or maybe in-person treatment is important. That was not there.
So you're saying that the integrative oncology is good, but not sufficient, not complete?
It's not completely there because they need support. And I think that's what I've been able to do so far, is to have a partnership with the integrative oncology group with Dana Farber, with MSK, and they believe in healthy living. And what they're trying to do is they are trying to do a research program which will allow these patients to combine the treatment of chemo as well as holistic approach, which will give them what they believe is that these patients will do a lot better. They will have a better quality of life, because the overall goal is not to the foundation's goal is not to overcome death. The foundation's goal is basically to provide a better quality of life so they can be more comfortable during their journey. Because what good is this treatment like chemo that can weaken the patients? 90% of the people who are on chemo are not effective.
Yeah.
Okay. Now they can be in remission for a certain period of time, but then that period, we want to make sure that these women know exactly what to do and how to live their life. what exercise they need to do. That's why we have exercise oncologists. Okay,
Yeah.
so there are a lot of factors that.
So there's a gap you're
Yes.
filling.
Yeah.
The goal of Alka Ohri Foundation is to
Right.
fill that. And one more important thing is emotional support, right? Family support, right?
Yes.
That is one thing Alka did not lack at all. It was tumultuous for us. It was very tough for us, but we were all together with her, right, during that time. And I know that February 2023 was probably amongst the worst months ever, for us. And soon after that, you started talking about the foundation, and honestly, many in the family were skeptical because we didn't know if you were just reacting out of emotion, whether this was going to go any place, even though we know you have a very strong pharma background. And people had questions, right? When we were forming the foundation, we were coming up, even the podcast topics we came up right then, a couple of months after that. It took a while to establish everything. But I saw we observed that you got a lot of traction with some big names, like you just mentioned, MSK and Dana Farber. Maybe you can talk a little bit about what was that process like, and what did you see was the reactions, and what was the exact specifics that they acknowledged that the foundation can fill the gaps.
So when I started reaching out to a few of the oncologists, and I must thank MSK in this incident, so the people that we knew, Alka's doctor, Dr. Jackie Bromberg, she led me to Lee Jones, who is an exercise oncologist from MSK, and he led me to Neil Iyengar, who is the head of our integrative oncology group. And I don't want to name everybody over here, but some of these people gave me a lot of knowledge, and they actually believed in my mission and vision because they had the same mission and vision that I have. And my objective was to kind of see how we can best tie with them to support this cause. And Jennifer Ligible, who is the head of integrative oncology at Dana-Farber, which is part of Harvard, and they were very supportive, and they reached out to me that they were very interested in what I was putting together. And I think that resulted into this journey. And it took me almost 9 months of back and forth conversations to really make sure that their vision and my vision are aligned. And I think that in starting May 1st, we signed the agreement with both the institutions, and now they have put together a protocol which will allow them to identify 50 patients on each site. And the purpose of these patients is to collect the data to show the impact of the holistic approach along with the chemo. So that's where we are today.
Ajay, I want to commend you because you could have just gone into a shell. I'm sure as some people can't blame anybody for it, because it was a big hit, and but you decided to make the most of it. You took the experience that you had with Alka, so you can do your best to make lives better for others that may go through the experience.
Exactly.
So, as a final question for this podcast, I know there's many more coming. We have quite a bit of good information to share, and we are hoping and we believe that it'll impact people in a very, very positive way. But what is next for the foundation now?
Well, what I want to do is I want to use this platform where I can provide knowledge through the experts who are part of who are helping me in supporting this journey. Number 2, the caregivers. Number 3, the experts in the nutrition area, exercise area. I want to bring patients to this platform who are going through this program and how they are feeling. So the idea behind that is that we want to use this platform to provide knowledge, especially to those patients who are in pre-existing condition, who have a family history. And number 2, patients who have stage 1, stage 2, or stage 3 cancer. So this platform, this episode, these podcasts should be able to help those patients to bring the knowledge awareness and take benefit from this.
In our next episode of the podcast, we will address a little bit more about holistic versus traditional.
I think we'll talk more about that because I think it's important. But I would encourage everybody to go to alkaohri.org, which will provide you some more details and more information as to what the website is all about and what the foundation is all about. And till then, we say thank you so much, and we'll talk to you next.
Signing off. See you soon.
Yep.
Stay tuned.